Thanks a lot, Björn, and I hope you enjoyed that historical perspective, what led us to write and negotiate and implement REACH. My name is Jenny Holmqvist, and I work with international activities here in ECHA, and I hope to give you the last remaining history until today. So what did we learn from 12 years of implementing REACH, CLP and BPR? And I will go through all those acronyms in my presentation. So thanks for staying on, and let's get started. Before I go into today's legislation, I want to take a step back and actually talk a little bit more about these elements that are part of any chemical legal framework that you develop or may develop. What you normally start with is a market awareness. So you want to understand what chemicals do you have on your market. You do that through an inventory of some sort, through notification schemes where industry are asked to notify certain volumes and substances. You do it through import and export control. Maybe Rotterdam Convention can help to get an understanding of chemicals that are imported to or exported in your country. And you can also choose a registration scheme like we have under REACH. Based on that, you will then start to look into the other information about these chemicals. And that information are normally relating to volumes and uses of these substances. You also want to understand what the hazard and the potential exposure is. This will lead you into the first cornerstone of any chemical legal framework, and that is the GHS, so the Global Harmonized System. That will help you to determine the intrinsic hazards with substances on your market. It will give you the classification and also the label. So the label is actually the communication tool in the supply chain on what are the risks and how can you avoid it. This will give you an opportune moment to actually look into the prioritization. So you have your market awareness, you know what chemicals are on your market. You also understand, based on available information, what the hazard are of those. Now, you won't be able to assess and look closely into all of those, so you will have to do some sort of prioritization, and that will be based on concern. Either the exposure are very likely, or the hazards of a specific substance are very high, or both. So the priority setting will give you hopefully a shorter list of chemicals that you will start to assess. When you do so, you will discover data gaps, which you will have to bridge, and that will eventually lead you to a conclusion on the concern that you had to start with. If the concern remains, you will then start to look into risk management options. So, and that will also bring in other aspects, which is not maybe what we think about first in terms of risk assessment, but what will be the consequences of restricting a use of a chemical on your market? What will be the socioeconomic aspects of doing so? What is not mentioned in this picture, which is equally important, is the actually fact that this needs to be a cost recovery perspective. So any work at an authority level, of course, needs to be financially supported. And this can be done through, for example, a fee system with your registration. And speaking of which, REACH actually have registrations. This is the fundamental part of REACH, where, compared to in the past, industry are obliged to submit information about the chemicals they have on the EU market. The information is the basic data sets that we as authorities, and not just ECHA, but also the member states, will look into when we determine if safe use or if a potential concern is justified. The registration is, of course, also connected to a fee, which partly also fund the work of ECHA. The concern that we may have could either be dismissed or valid, and that will lead us to the next step of an EU-wide risk management measure. And this is not just done by ECHA, but of course also in collaboration with member states, and actually also other partners, which we will look into more in the coming slides. Something that REACH also had, which I probably should have said on the last slide, is that REACH also have a fundamental principle incorporated or embedded in the legislation itself, and that is the precautionary principle. This underpins the work that we do here in ECHA and also the work that member states do in relation to REACH. And I think this should be mentioned because they was not part of in the same way, at least, in the legislation that was available before REACH was implemented. So looking back to the 1967, as Björn mentioned, this was the first EU-wide directive that governed dangerous substances. This compared to then 2007 when we had REACH 12 years ago. That REACH stipulated 3 different registration deadlines, and this was based on volumes. And why the volumes are so important is that information requirements in REACH are determined by the volume. So the more that is produced or manufactured or imported, the more information industry or registrant are obliged to submit. So we have had 3 registration deadlines already. The first one was the high volume, and that was 2010, followed by 2013, and then last year for the lower volume, up to 100 tons, which is still quite a lot. Looking into these registrations, what have they brought us so far? So we have up till now nearly 23,000 substances registered under REACH. The difference between these 2 lines, the registration versus the substances, is that a substance can be manufactured by many companies, so meaning that a substance can be registered many times. So, but the number of substances is nearly 23,000. And why is this an interesting figure? It is because if you look into the global context, we know that there's around 40 to 60,000 substances on the global market, meaning that at best, a little bit more than half of them are now registered under REACH, meaning that we have a basic data set for those 23,000, nearly 23,000 substances. This is a figure that, of course, is live, so this is going to increase over time and it's going to change. So this is what we have today. What is also important to point out here that many of them are not necessarily manufactured in the EU. They're actually imported to the EU. And this is again bringing in the aspects of a global market where EU is not an isolated part of it, but actually collaborates and trade with other markets globally. So, and also, now, the more sort of interesting part is, of course, I mentioned this data, the basic data set. What information has this regulation brought us? Well, we are certainly in a bit better days now compared to before REACH. We have over 2 million robust study summaries, which is all publicly available. We have been able to identify over 200 substances of very high concern, which is for us the starting point, of course, for example, certain risk management measures. What we also have done is that we have actually looked into over 2,000 of these substances for compliance check. We have not necessarily opened all of them, but we have at least screened them to some extent, done targeted assessment, and looked into them to ensure that these substances, the information we have, points towards that either they are safe or the safe use can be ensured, or that further risk management measures may be needed. So what is also good to point out already now, we will come into that later on, is that the CLP, which is the GHS implementation in the EU, has generated over 140,000 classifications of substances in commerce. Evaluation or risk assessment in the past was something that was done by authorities. The burden of proof to show that something was a risk or that the risk cannot be adequately controlled was on the authority. This is what Björn mentioned about the reverse burden of proof. Thanks to the REACH and the obligation on industry to submit information on the substances that they have on the market or put on the market, authorities, including ECHA, is in a much better position to actually evaluate that information. And this is done in 2 different processes. We have the one that we here in ECHA do, and that is the dossier compliance, where we look into dossiers that has been submitted to ensure that the data that is in there is good quality, and also that the information that has been submitted corresponds to the legal text. There is another kind of evaluation which is done by member states, where they look more into all the information concerning one substance and evaluate if the information available is sufficient or if further information is needed. This is a process which is normally based or is based on a concern. So a concern is identified with the substance, And then that's the starting point for a substance evaluation. Looking into the risk management options under REACH, we'll start with the restrictions. A restriction is about restricting certain uses of substances where there is an unacceptable risk to human health or the environment. This is the continuation of the limitation directive that was mentioned during Björn's presentation. And in order to reach a decision on a restriction, there is a comprehensive risk assessment that is made either by us or by member states. And that also includes a socioeconomic analysis where considerations about socioeconomic impact, both benefits and also financial drawbacks of a certain option are considered. These are all forming an opinion from ECHA's side that is then sent to the Commission. Once the Commission takes the decision, it's legally binding and forms an entry into Annex 17 of REACH. Moving on, and the other option that I wanted to tell you, also part of REACH, is the authorization. The authorization is the opposite to some extent to restrictions, where everything is banned, so all the uses of the substance is banned unless you have an authorization. This concerns substances that is carcinogenic, mutagenic, or reprotoxic, or alternative that they are of concern for the environment, such as persistent, bioaccumulating, or toxic. There is also an option to look into equivalent concern, which, for example, could be endocrine disruptions, sensitization. This is done either by us or member states, and based on the substances of concern, they are then pushed onto what is called the candidate list, and later on into the authorization list. The authorization list, once the substance is there, it has a sunset date, which after this date you are no longer able to use it unless you are having an authorization. And that decision is, of course, also considering aspects such as substitutions, are there alternatives available, and again, the socioeconomic aspects and not only the risk perspective. I mentioned earlier the importance of GHS. In the EU, that is the CLP regulation. The CLP is, again, the first step in actually understanding hazards and also, in a way, to communicate down the supply chain about those hazards on chemicals. In the EU, we implemented the CLP already 2008 with 2 different deadlines for mixtures and single substances. Our role here is, of course, to maintain the CLP inventory, which is this over 140 classifications. What could be good to know here, if you ever wanted to have a look at this library, is that there are 2 different classifications available. There is one that industry do themselves, and there is one that authorities do. The authorities already established classifications on substances on the EU market before REACH, and those classifications was later transferred under CLP. And the work of doing this has continued, and we are constantly implementing new harmonized classification and labelings of substances in the EU. What I also wanted to say here, that classification and labeling are also, in a way, a risk management tool. There are several sector-specific legislation that looks into the classification of substances as a way of excluding certain uses, like toys, for example, and other sector-specific legislation. The biocide regulation in the EU does not, we do make a distinction between biocides and pesticides. Pesticides is currently with our sister agency, the Food Agency in the EU, and we are focusing on the biocide. Here, there are several elements that, of course, are very similar to REACH, which is in terms of data that needs to be submitted. There are several cost sharing among industry that has to be looked into and considered. And for us, we are really looking into the active substances and the authorization of those. And this is a work that is also done together with member states at the EU. Something that is not always considered when we talk about the achievements and success stories of the legal implementation of REACH in the EU is not just the data. We have consolidated a large volume of data, but we have also a long tradition of a transparent decision-making process. This entails already before REACH was implemented, consulting on decisions, ensuring that relevant stakeholders are at the table, including a dialogue with manufacturers and importers of chemical substances. We have continued that and we have refined it, and you will hear more about that in terms of how to access this data, how we have tried to adapt the information that we share via our website to different audiences by my colleague Owen after my presentation. But the decision-making process is also a very interesting aspect, a benefit, a positive impact of the regulation here in the EU. We are aware of that industry wants to have predictability of the processes and decisions that are made concerning substances that they put on the market. And this is something that we are trying to achieve here through a tool that is available on the website, where we clearly indicate which substance are in the future, within the time frame, going to be looked at through a specific process, and also tells the industry how they can interact, when can they submit their input and comments on such a decision or such a process. And this is called the Public Activity Tools Pact. There is also a Register of Intent, ROI, that is also available through our website. So we have several tools available to very transparently early on indicate when our processes, a specific process will kick in, how you can engage, how you can interact, when can you send your comments, suggestions, additional information, and so on. So this is also something that when we speak to countries outside the EU, that sometimes it's a challenge to make sure that all stakeholders are involved and feel involved in decision making. Moving on a little bit what we do at the international level, I'm going to quickly give you a couple of aspects on this. Of course, a lot of our operational work demands that we have test guidelines and methods in place, and Björn also mentioned the work at OECD level. A lot of our efforts, of course, goes into making sure that those are also adaptive and relevant for REACH and COP. We are also having reporting systems that heavily relies on international work, such as Euclid. And another part that we also do here with OECD is looking into the ways of using less animals for establishing hazards or testing for hazardous properties on chemicals. We also have a number of other engagements with, for example, WHO, which is the reason why we are here today. We are also involved in supporting the Commission on the conventions such as POPs and PIC, so Rotterdam and Stockholm Convention, and we're also doing capacity building, in particular in the pre-accession countries in the Balkans. Another aspect that has an international quotation is the discussion currently on circular economy, where for us, of course, chemicals is the motor. Whether or not you talk about products, whether or not you talk about materials, end of life, and in the waste operators' hands, the knowledge about chemicals, the knowledge about which chemicals are of concern and how they can then be removed from the waste streams are of utter importance in order to succeed in achieving circularity. And then where do we want to go? We have gone quite a far bit already. We do have identified and continue to identify synergies with chemical legislation and nearby areas such as worker protection, such as sector-specific legislation, cosmetics, toys, and others. There are a lot of interlinkages that are important to identify and also explore further. We do also see the need to step up and try to support more developing countries and economies in transitions when they are trying to develop chemical legislation. And in particularly point out how the information that we have, both in terms of the decision-making processes, but also the data, the assessment that we do, how can they be used by others. I want to just leave you and also give the floor to Owen. I want to leave you with a couple of conclusions from the learnings that we have, or lessons learned over 12 years of implementing REACH. I think it's fair to say we know a lot more about chemicals today than we did in 2007. There are still important data gaps that needs to be looked into, and especially if you look into the global market and the number of chemicals we think are in commerce. The reverse burden of proof, well, I think we have the legal instrument is certainly there. REACH has enabled a turning of the tables in terms of requesting industry and making them responsible for the safety of their chemicals. However, there are still some issues that needs to be further improved, and in particular in the risk management areas where industry needs to be better encouraged to come forward with information about their chemicals. And then I was just to finalize on the international collaboration, because we do see that as a crucial point. EU is not an isolated market. It's trading with a number of trading partners at a global level. And if we are going to achieve a safer chemical management here in the EU, we need to collaborate. We need to come together and address a number of issues, such as substances of concern, together with others, with partners. So this is really in the core of our activities. Thank you very much.